I was diagnosed in December, early December, with stage 3 lung cancer, adenocarcinoma. They're doing cycles of chemotherapy and radiation, as I said, 5 days a week for 6 weeks, and then going on to the immunotherapy.
I'm a medical oncologist and currently the clinical director of Cancer Care Services. Adem Crosby is our sort of main centre. This is the first public radiation facility that we opened up in 2017.
We do a whole journey approach with our patients. We meet them at diagnosis and we follow them all the way across. So a big part of what we do is making sure that within the community they've got all the support that they need to be able to go ahead and have the treatment that they need.
You know, while people on radiotherapy, they can get particularly some of the intensive radiotherapy we're giving for head and neck patients, for patients with lung cancer when they have a combination of chemo and radiotherapy. They can get a lot of problems and they need sort of a daily assessment, a lot of nursing care, dietitian support.
As it progresses over that 7 weeks, the side effect burden builds, and so you're talking about symptoms that are very much related to pain, to nausea related to the chemotherapy, fatigue. The fatigue is extremely difficult to manage.
When I did my first cycle of chemotherapy, the fatigue sets in. With the radiation, I'm just tired all the time. The last couple of days, my bones, they just ache. It's hard to walk. I mean, I don't want to complain, but you just feel it, and the fatigue. You're just tired. You struggle to do things, basically.
Anyone having radiotherapy is coming down here. So either they've had to transport themselves, they've had to organise accommodation if they've got family down closer to Kawana. It'd ultimately be the best thing for patients if they could be at home. But if you can't be at home, then you need a home from home.
We have a large catchment, so we reach out all the way up to Tin Can Bay, and we go out west past Nambour and south down south of Caboolture. Yeah, so we have a large catchment for patients. We also have a small cancer care unit in Gympie and one in Nambour as well.
We allow 2 hours to get down here because you just never know what the traffic's going to be. Normally we can do it an hour 3/4, I suppose, maybe. Yeah, but we just leave that little bit of extra time, yeah, because the traffic, you just never know with the traffic.
One of those big things that we wanted in the build-up to this and the Sunshine Coast University Hospital was some form of lodge where people don't have a lot of money and travel is a long way, and if you're coming in for daily radiotherapy for a few weeks, it's just fantastic to have some sort of facility where you could stay or share accommodation with family, but even if you could just stay and come in on a daily basis for treatment with that sort of support is just what we all have always wanted. We've got our gym here which Wishlist donated us, so I've got an exercise physiologist here. If they're close by, they can make use of the gym facility. They can do all that sort of stuff which helps their care. And I think that's the exciting thing. If you've got a place in a facility where people can stay and feel like they're getting that sort of holistic care rather than a sort of fragmented care where they're just dashing in, having 15 minutes and have to get back in a car for 3/4 of an hour, or even, you know, from northern Gympie it's maybe 2 hours drive from distant parts of the coast. So a huge thank you to Mix FM and anyone who's donated through that Give Me 5 for Kids for the land, and for Osmar, and obviously they've pulled a lot of favours and things out there to support the building of the house. So it's a wonderful thing for both of those, I suppose, community businesses of the Sunshine Coast to step up and give this to the community, and I think that there'll be appreciation for many years to come. So thank you.